Okay, what?
Are you fixing anything this morning?
I can.
Are you hungry?
Not particularly, but I can fix something.
Oh, you don't want to, well, you don't have to know if you're not really hungry.
Up to you.
I'm going to leave here because I forgot that they're coming in at 12 o'clock.
At 12, yes.
Yeah, so it's a couple hours. I don't know if I'll be gone at that time or not. But anyway, are you busy now? I didn't know if you were busy. I didn't want to stop you from anything you were doing. Oh, by the way, that thing was excellent. I'm listening to that 2-3 times. The one by Neville Goddard about Kai. About being you and calling.
Living life.
Huh?
Living life from the truth that you've been chosen, called,
Yeah.
sent
Yeah.
on a mission of God.
Good morning, everybody.
Good morning. Good morning, Rudy.
Good morning.
It's Maria.
Just coming in, just say where you're calling from and say hi, and just then.
Hi, this is Maria Peterberry from New York, Long Island. Hi, everybody.
Well, good morning. Good morning from New York.
Hi, this is Warren from the Philippines.
Hi, this is David from Austin, Texas. Hi, Maria. Hi, Stan.
Dr. Rich and Linda from North
Dan.
Carolina. Basil. Hi, Rich.
Linda.
Hi, Linda.
Good morning.
Good morning.
Good morning. This is
Hey,
Jeannie
there he
from
is, the man
California.
with the hat.
Good morning, Janine. Good morning.
Morning. Like the hat, Rudy.
Good morning, Dr. Amy, all the way from somewhere in Arizona or.
That's right.
Rudy, Dr. Rich and Linda, we received our product Friday. Thank you.
You're welcome, Rich and Linda. Good morning. Just we're waiting for others to comment. I will be talking a little bit about the company itself, and then Alfredo will be introducing the doctor to come in. At that point, we want everybody to be totally muted, and we'll have a great recording. So let's give a few more minutes to get other folks to come in and so forth. Okay.
Good morning, Rudy.
Good morning. How are you?
Good.
Are you using these your slides, Rudy?
Reliant on the father's provision. I see that phone. No. Not yet. I see Albert, you're there. So
Rudy, do you want to use your slides? Are you showing your slides or what?
Say again?
Do you want to show your slides? Do you have a slide?
I know you do that after. I'm just gonna you do that when Albert is ready, and
okay.
And then you started recording at that point. At this point, we just give a few more minutes. Still a few others should be coming in.
The devil indicated, referencing Psalm 91's assurance of celestial messenger protection. In this instance,
somebody is not muted. I could hear background noise too. Good morning, Dr. Shuri. I see you here all the way from Florida. Good morning, everyone. Before the doctor come in, I want to go ahead and give us a little bit about the company itself. Of course, the company is AFC Life Science Indonesia. It all started way back in 1935 when a company formation called AFC. AFC stands for Asiama Family Club. And in 1945, they became a pharmaceutical company. And in 1969, they become a nutraceutical company on top of that, and they call it AFC Life Science Japan. AFC Pharmaceutical is the largest pharmaceutical company in Japan today, and AFC Life Science Nutraceutical is the largest nutraceutical company in the Orient. And it is all started from the laboratory from the AFC Life Science in Japan. Okay, and the products were brought into Indonesia under AFC Life Science Indonesia, and started there with a project to study more about the product. And they spent the first 2 years using doctors and doing the studies and so forth. And then 2 years later, they formed up what they call the mobile stockist program. And they were selling products to these doctors, and they were using the products with their patients and clients. That's how it started. And in 2017, that's when they start talking about bringing to the world and using the system into Indonesia, because this is pretty much considered as a pharmaceutical, drug recorded under the MIMS in Indonesia. So that's what AFC Life Science and how it started. And the three main products, of course, is the Utsikushi, the Subsubarachi, and the Hikari. And at this point, just a little bit briefing on it. Now, Alfredo, go ahead. If you go ahead and introduce the doctor. Thank you.
Thank you, Rudy. Good evening, everyone. Good morning. We are about midnight here now in Malaysia and Philippines. Okay, to begin with, let me just introduce the main speaker tonight. Our guest speaker is Dr. Albert C. Punzal. He used to be a medical researcher. Okay, he himself researcher for mechanism of action on foods, bioactive ingredients, substances. Yeah, he's educated in doctors of dental medicine, trained in integrative and complementary medicine, naturopathic medicine practitioner. He was involved. He was a speaker for the International Resource Speaker since 2002, and he's also belongs to the Toastmaster Philippines Winner Table Topics. So without further ado, let me just call Dr. Albert to take over. I'll pass you the host.
All right. Yes. Good morning and good afternoon to everyone here in Asia. We're in the evening, going to midnight, and I do have some requests though. Just for the house rule, can we mute our gadgets, and so that we can
How do you mute them?
so that we can we'll be able to talk to or discuss the information that is or the topic right now this morning. And
you can mute in the bottom left corner. Mute in the bottom left corner.
Yes. Hello, Warren. How are you doing?
I'm doing great. Thanks.
All right. Very good. Very good. So we start now, and let me just retrieve my PowerPoint presentation. So we don't have any daylight savings times as the moment. So we are the same, almost the same, 12 hours difference in Eastern Standard Time. All right. So there you go. Okay, can anyone see the PowerPoint product knowledge guide for reverse? disadvantages, health issues. Okay.
Can see.
So can you,
Yep.
Alfredo?
Yes.
Can you hear me? Can you hear me well?
Yep.
This is
Very clear.
very good. Very good. So let's start. Okay.
Start recording.
Yes, we are. It's actually, we are recording at about, we have consumed 12 minutes, more than 12 minutes. Okay, so let's start. Good morning again. My name is Doc Albert. They call me here Doc, Doc Albert, whatever you want, may please you. So this is the product knowledge that we have in AFC. Okay, first of all, we have the Subsubarashi, the upgraded one. We have the 6 peptides or hexapeptide that they're calling. Okay, and some of the actions that we have here is actually, all right, some of the actions are stem cell therapy, in which the actual production of bone marrow stem cell is encouraged and activated by taking this kind. Okay, and the ancient times, the 1700s, will not be able to recognize that terminology, but that's what's happening since the 1700s, when they found out the actual salmon raw, okay, has the ability to initiate the healing process. That's why we have DNA repair as well. These are sources, okay? Peptides are broken down to nucleotides to repair the DNA. And this is also for cardiovascular support. The same thing with, okay, Utsikushi. Okay, why both of this has cardiovascular support? Because based on their research, is actually very good in terms of your blood pressure. Otsikushi is actually powerful. It is actually dealing with the gut microbiome health, which is the center and focus of 90% of all, either you are healthy or not, because 90% of the gut microbiome, okay, actually 95% is or 95% is found in the gut, okay, and 70% with the coordination of the good and bad bacteria plus the immune cells are coordinating with each other at the gut level. So if you have a healthy immune system, because the immune system, 70% of it is actually located in the digestive tract, which is the gut. And that's why we have the immune bolstering here, immune boosting. At the same time, it has a connection. The vagus nerve is in connection with the gut and the brain. Okay, the gut and the brain, and that's why we're going to actually discuss some of the information about the Subsubarashi no Tsikushi. Okay, another thing here we have Hikari or Hikari or okay, whatever the pronunciation, as long as we're taking it, it's for the brain power, the memory, the mental health, the eyes, the skin, and not only that, but it's actually because of one of the patented ingredients here is actually for sports health. Okay, it actually increases the endurance when you're taking hickory. And this is together, these are actually an energy producing, okay, at the cellular level, okay, at the powerhouse of the cell level in terms of production of energy. Now let's start with the okay, wait a moment. Okay. All right, I do apologize. It seems my PowerPoint presentation is frozen. All right, that's great. All right, let me just do that again. Okay. Mm-hmm. I don't know what's happening. All right. Please bear with me. I'm just going to retrieve the PowerPoint. There you go. Okay. I think I need to reboot my PowerPoint. Please bear with me. Okay. While I'm discussing the importance of the Sopsobalashi, because there are only three biotech or production of this kind of level of DNA repair functional food. We call this functional food. Some call it nutraceuticals, okay? Some call it food supplement, whatever we call it. Okay, these has an action in the body, okay? All right. All right. Something wrong with my PowerPoint. Please bear with me.
Dr. Albert, this is Dr. Gamut. I have a quick question. If you can explain.
Yeah, please. I'm just retrieving the PowerPoint here, and I don't know what happened here.
Okay, great. Because there's a lot of peptides in the world. There's shots. There's a lot of other formulations. Can you explain why ours is different from the rest of the peptides out there? Is it more powerful? Works different? How is it?
Actually,
compared to the market?
the peptide that we have here is actually it's a whole form of peptide, which means it is more than 100 peptides that's included here. The body has the ability to fold this to create this peptide through the when you take this, it is a form of protein that is actually penetrating the cells, and the cells will actually create, it will transcribe it, and that peptide will actually form proteins and fold that protein accordingly what the body needs. We have an innate intelligence here. Okay. All right. I think my please bear with me. Hello, can you hear me? Can you hear me?
Yes, we can hear you.
Oh, yeah. Okay. There's a damage in my PowerPoint. Okay. I don't know what happened here. Let me just try. Okay, I do apologize for this inconvenience. The protein. Okay. I'm just locating the information here. Please bear with me, sir, or doctor. I'm not comfortable if I've not retrieved the PowerPoint that we need here.
water in my water bottle or anything?
All right. The peptide here is actually it's actually folded. Okay, the peptide is actually transcribed or translated and transcribed into the necessary proteins the body needs. Okay, my USB is not being recognized right now. I may get back to you. I will, I will actually reboot, and I will be off the Zoom meeting. I'll return in just a moment. I need to repair my USB. I do apologize. Okay. So Rudy, can you take over, please?
Yes, I'm here. Anybody? I hope you get this PowerPoint back on as possible.
Just give me 10 minutes.
All right.
All right.
So,
okay. Thank you.
in the meantime, if anybody have questions and what we can answer, go ahead and unmute yourself, and we'll see what we can do to answer. And Alfredo, you're there?
Yes, I am.
Okay. So while we're waiting for Dr. Albert to retrieve the PowerPoint, anybody open for questions either way for about the product or the business, either one. It's fine.
Rudy is Dr. Rich in North Carolina. Last week they talked about different conditions. Has anybody had any response with Lyme disease that you know of?
Not personally on Lyme disease, but how about you, Alfredo? Indonesia, Malaysia?
Lyme disease?
Lyme disease?
I have to refer back to Dr. Yudi on this. I'll get back to you, Dr. Richard, is it?
Okay, so we'll retrieve that.
Fine.
Anybody with Lyme disease, I don't know whether Dr. Yudi should be able to have an answer to that.
It's interesting. Other countries might not even have Lyme disease.
Any other questions?
You know, it was formed right on Long Island. I mean, it's not.
What about MS?
There are some studies. If you go into PubMed.gov, you can see some studies been done there. There's over 41,000 studies completed already, put in PubMed.gov, and there are 3 or 4 studies related strictly with MS.
What about, hi, this is Jeannie. What about tinnitus, ringing in the ear?
Goodbye, ringing in the ear. That especially using the Hikari, ringing in the ear. We got a lot of folks have that, including my wife, including a sister of mine, including a lot of the relatives that tried it had a problem. Notice that that's one of the quickest results. But when you're taking the Hikari, it's recommended to take it 3 times a day on the first month at least. Okay.
Thank you so much.
Hello, Roy.
Good morning, Marshall.
Yeah. Have you had any results with glaucoma, in particular, primary open angle glaucoma?
Alfredo, you want to take that question?
I have a video on that. There's one lady from Australia. I may post it in the group. Yeah, it's a video. Yeah. So this lady is from Hong Kong but residing in Australia. She had a very good result on that recovery. I may send it to you, Rudy.
Yes, please forward it so we can forward it to everybody. Okay, appreciate that.
Thank you.
There was asking about, before you ask, Dr. Anuska, somebody was asking about MS. Yeah. So
yes, that was me.
Okay. What I know about autoimmune, when we are handling autoimmune diseases, these are what the doctors are recommending in Indonesia and Malaysia. They will start with Subarashi first. Okay, they will they will start with Subarashi probably in a week. You may start with 1 to 2 sachets a day, twice a day for a week. Then you need to combine with Utsukushi eventually on the second week onwards, and combination continue up to 3 months. Yeah. This was the standard protocol that, which they give to any autoimmune cases. Yeah. That's about it. What I can share. Xavier?
I appreciate that. I'll get more later after maybe. Okay, appreciate it. Thank you.
May I ask you a question?
Yes.
Hi. From the scientific point of view, like I'm wondering about the mechanism of action and clinical trials as a scientist, and also the hormonal regulation. Yeah, thank you.
Again, I've seen some of these articles and a lot of the research on being displayed in PubMed.gov. All you have to do is go to PubMed.gov and just click what you're looking for, and a lot of the studies will start popping up. It's right there. So you just click on it on PubMed.gov. Like I said, those studies were just coming in PubMed in just the last 30 days. Most of these never been put in before, so I welcome that these products and all the studies that have been done is right on a fingertip today. So yeah, a lot of the research are right in there. Just click on it, you'll see it.
And so my keywords would be AFC peptides, or like hormonal upregulation, or I mean.
You could write down about hormonal. You could write down about anything, and a lot of that relating to the subject will pop right up, and on the studies that have been done. A lot of these studies were actually done from other countries almost 20 years already. It's not something just popped up out of the blues, but of course AFC and the discoveries of how this thing worked from the laboratory has been going on for more than 15 years, until finally about 9 years ago is when they start the complete formulations of the Uchikushi. Okay. But today, there's a lot of articles, a lot of journals of medicine have a lot of these articles all over the world.
Hello.
Good morning.
Morning.
You have a question, Janet?
Can you hear me?
I can hear you.
Oh, cool. I was just waving at Anushka. She's a friend of mine, wherever she is, and I just wanted to say hello, and I don't know if she saw me, because I look different. My hair's all cut off. She remembers.
Oh, I'm very happy to see you.
Thank you. Are you in Florida?
Yes.
So am I. I'm in Sebastian, by the way, for a week.
I'm in Miami. Oh,
I'm going to Miami.
When?
Next week, Wednesday through Sunday. Then
Wow.
I have one night where I have nowhere to stay. Maybe we could get together. I fly out Monday.
It's a good
Okay,
idea.
sorry, guys.
Call.
Dr. Albert, how are we doing?
Knows it. Yeah.
Thank you. So I'm just here to hear about the products, and I got on late.
Yeah. It's very interesting. It's probably fixed a lot of problems in the body. I
All
just
right.
yeah.
Anushka.
It's a nice version of Anna.
Yeah, very nice. I like it.
What's going on?
Hello, can you hear me?
Yes.
All right. So thank you for patiently waiting. Okay.
All right, let's
And
jump on.
yeah, I just changed I changed my laptop to a different one. Okay.
All right,
So,
Dr. Albert,
all
welcome
right.
back.
Okay,
Everybody,
thank
please
you.
mute yourself.
Yep. And yep, yeah, it's different camera. I
made you a host already, Doc.
all right, very good. Okay, so let me just go here. One of our dear doctor is asking regarding the peptide. Why is it different from other peptide? The other peptide has a what you call it, a specific action. Okay, depends on the peptide. Okay, for losing weight. However, the peptide in Subsubashi, okay, number one is actually for cell repair. The peptide here is replenishment of the nucleotide that is when you say nucleotide, that's the smallest form of the molecule of a human or a mammal or a for us, for humans, okay, or animal, okay, the smallest form of molecule in a mammal, okay. So that is the first function of our peptide is for repair, okay. The repair here is actually very broad and very vast. Why? Because the body will actually dictate, because of its innate intelligence, will dictate, okay, what is the weakest, okay, weakest part of the body, and that will be the first part of the organ. We call this the principle or law of cure from Dr. Herring. Okay, Herring's cure of law. Okay, so what's Herring's cure of law? Cure of law, which means the body will first of all delegate or give first the priority for the weakest area of the body or weakest organ of the body, and then the strongest or the less weak. Okay, so the weakest to the, and then the initiation of this for the peptide for the repair, it will come from the inside. Okay, the inside of a person going out. That's why I'm suggesting that the side effect here, if you have, if your skin is glowing, your skin is very healthy, which means we already, or the food that you took, or which is this one, the peptides that you took, a marine peptide that's already done its job, and that's why your skin is healthy and glowing and and fair. So, can you see the screen, by the way?
Yes, we can.
Yes.
All right, very good, very good. Okay, so all right, there you go. I just want to see the participant here. Okay, so again, please kindly mute your mics while I'm giving a discussion about this. I hope Doctor, the one who asked about the difference between the peptide here is answered, because the peptide that we have is natural peptide. We only use the science of the biotech from Japan so that we can extract it, and that will actually go to the different parts of the body, whatever whichever is actually weakest, that will be the first beneficiary of that peptide that we have from Subsubashi Utsukoshi Hikari. Okay, so this one, we have the marine placenta peptide, which is already a standalone. They already have the what do you call this? They have the clinical studies that they have. We have sardine peptide, we have fruit flow from tomato, we have stevia, pearl barley, yogurt powder, vitamin C, and glutathione, which is actually synergistic in helping preserving the content of Subsubashi because of its marine, and then it's actually helping the body to gain the vitamin C and the grandmaster of the antioxidant inside us. The liver is the one producing this one. Okay, so let's proceed. Before it was a tripeptide, now it's a hexapeptide. We have tuna heart peptide, salmon caviar peptide, and anserine peptide. So first of all, the tuna peptide here is it's actually for the inflammation. It's an anti-inflammation for the heart. It's an antioxidant. It's protecting us from the excess production of what do you call this? Excess production of free radical, and this one, some free radical or reactive oxygen species. Okay, and the best thing about the tuna peptide, it has a specific peptides inside. Okay, so these are PKK. These are other peptides inside. Some of it is using for cosmetic use. Okay, and some of this is functional food and oral intake. Okay, and since that this is from the heart's cardiac arterial bulbs of a tuna. Okay, everything in terms of the ingredient inside or the active peptide inside, that is actually helping the body. Okay, but first of all, we need to dig deeper about the PKK, YEGGD peptides here, GPGLM. In the future, we're going to discuss that. Okay, because this is part of our learning process, so that we can understand the action of the tuna heart peptide and other ingredients. Okay, as I mentioned a while ago, okay, it's actually protecting us from oxidative damage from the excess production of free radical. And what we have here is the H2O2, which is a peroxide. Okay, and if you're aware, these are actually damaging the cell membrane. Okay, especially the cell, the brain cells. Okay, they actually damage it, and because of the production of other free radical. Okay, and I'm just careful with my term here because some of the terms here are very technical, and these are destructive in terms of the cell membrane. That's why tuna heart peptide is very powerful when they added this in our sopsubashi. Okay, the same time, okay, it is actually helping the uric acid management in this one. Okay, and even for a better skin, because the better skin, which means that these are actually addressing the internal organs in their anti-inflammatory or their inflammatory state.
Albert,
Another thing, yeah.
Sorry to interrupt. Albert,
why?
There's the request. Can you shut off your your video so that they can read? Because it's your video is too big. It's blocking the slides.
Okay.
And also,
you change the what do you call this, the orientation on your screen. Okay, your face is too big. All right, sorry about that.
Okay, no.
I have a big face, and all right, let's proceed. Okay, for the salmon caviar peptide, it is actually the same thing, anti-aging. Okay, and it's actually formation. The other product here, the collagen, what do you call this, the fruit flow, and the sardine peptide has also this kind of collagen and elastin. Okay, and which produces the appearance of fine line and wrinkles, which means that these are actually very good for the skin, for the hydration of the skin, not only the skin but also the cells. It has an innate omega-3 and partially omega-6. regeneration, not only for the skin, but also for the cell. Okay, these are raw materials. Later, I'm gonna discuss that. Antioxidant protection and anti-inflammatory. Okay, so this one, these are seemingly a pain reliever because of its anti-inflammatory process or anti-inflammatory action. Okay, another thing is the anserin, okay, which is actually a pH regulator that is, prevent fatigue, muscle fatigue. Okay, it is also very good for, cognitive functions and brain functions. And this is an antidote for, for people who easily forget, okay, for dementia. Antioxidant, the same thing. We are not actually, no, it's saying it's just an antioxidant. Remember that there are thousands of species, okay, hundreds of species that of free radical. And as we know, free radical is supposedly helping the body to kill cancer cells, virus, and bacteria. However, because of its excess production, this one, because of lifestyle habits, of bad habits, okay, it's increasing, especially if you're stressed, okay? And when you're stressed, what happened is actually, getting the body to react. And inflammatory process is actually, it's an everyday, what do you call this? Everyday event in our lives. So these are full of anti-inflammatories here. And when you say anti-inflammatory, even pain is actually addressed here. Okay, it's also good for the blood glucose tolerance and the productions of receptors in our cells, so that the insulin will be sensitive. Okay, and this is also good for the kidney, okay? Especially if you have if you are actually in going to the kidney problem stage here, okay, of kidney issues, okay, and these are very okay, or improved kidney function. It's also good for the the picture that you're seeing right now is actually a blood vessel that is clogged, and because these are marine products and peptides, okay, and producing a certain amount of proteins inside the cell that will actually help the declogging of this, especially the product has an innate omega-3, okay, and it's actually using it to help dissolve this kind of blockage. All right, triple peptide, now it's hexapeptide. Okay, by the way, the possible benefits here, the heart is actually getting stronger because of its repair system, normalizing the blood pressure because it has an ACE inhibitor, which is a this is a natural ACE inhibitor, not a synthetic type. Blood vessel, these are the ingredient here is also a vasodilator. It actually helps to produce the endothelial cells or the endothelium the necessary amount of nitric oxide to dilate and relax. It's also reducing the risk of diabetes because of restoring the pancreas in terms of its glucose tolerance and the production of insulin and making it insulin sensitive. Kidney function, this is especially for people who have kidney injury, okay, especially acute kidney injury. These are repair system, Subsubahashi, the new one. Okay, cell membrane cohesion, okay, improve the electrical potential, the exchange of minerals inside, because these are marine products with have innate trace minerals and minerals here that actually improve the electrical potential and make the cells energetic. And so the body is also energetic. It's a stem cell therapy supposed to be. Okay, it helps produce and replenish bone marrow stem cell, and this bone marrow stem cell either replenish the one that is actually depleted. Are you aware that our body has there are cells that dying 300 million in terms of 300 million a day, or 1.2 kilos or 4.4 pounds of cells that dies every day. That's why we need a potent nutrition to initiate the stem cells in our body. Okay, this is also stem cells that reverse the aging process. Okay, and rejuvenation. And why? Because of the formation of the ingredient inside, so the skin will not sag, like the elastin, the fibroblast, the collagen. The brain, reducing the risk of stroke and reducing the formation of these we call this peroxynitrite that destroys the cells of the brain that makes you forget. By the way, these are powerful peptides. Okay, that's why there's a multiple action in this kind of peptide. Okay, this kind of amino acids and proteins and peptides. Okay, there are actually connected together. The hair and the skin. Okay, some of the subsubalashi here, the ones that we ones the what do you call this? The testimonies that we have showed even skin is actually there's a formation of the hair follicles for people who's like me. Okay, bones, remineralization is a mouthful, I'm sorry. Remineralization of the bone to prevent from either osteopenia or osteoporosis. Muscles, okay, prevent sarcopenia, because every year, okay, 10% of our muscle mass is actually depleted. That's why these are raw materials. These are food. These are actually help initiate, though it's small in its amount when you take it, but it's a powerful powerful cascading action. What do you mean by that? It's like a snowball effect inside the body when you take it, and there will be consistency in the muscles, even the joints. Okay, some of the ingredient here can actually restore the joints here, joint cartilage. And one more thing is these are DNA repair system. Okay, the DNA repair. Okay, we have a lot of DNA repair system. We have the nucleotide excision repair, support, and so on. These are our DNA repair raw material that body needs for proper restoration of its function and health. Okay, the patents here. So these are the patents. I will show that later. Okay. Before we have only 4: cell repair, regeneration and production, improved peripheral flow. Okay. Anti-hypertensive because it has an ACE. Okay, it's based on ACE inhibitor, and it's an anti-thrombotic agent or anti-platelet aggregation. Now it's actually even an anti-aging effect, cell rejuvenation, even clearing up the functions of the liver to prevent from deterioration. Okay, sorry about the spelling there. Okay, and reducing the acid buildup in gout formation. Why? How? Because sometimes the processing of the proteins that we eat, the red meat, anything that is protein based, eggs, milk, cheese, or red meat or white meat. Okay, there is a bottleneck in the production. Okay, and that's why the Subsubashi is the one releasing that bottleneck, so that there will be less gout or less uric acid production. Okay, so this one is the body, and the body has, you know, most of the absorption here is in the small intestine. If we're gonna take it by sublingually or in the mouth, it will be absorbed in the gums, the cheeks of our inner cheeks, okay, of our mouth, and it goes to the villi, and the villi goes to the, okay, to the cells. The cells now is fed. Okay, the number one here, based on the information that we have here, the amount or the molecular size is in between of 400 to 600 Dalton. Okay, and based on research, 1,000 Dalton is equivalent to 1 to 2 nanometer, okay, which means this will penetrate our product easily diffuse. We call it diffuse in physiology. Okay, it diffuses inside the cell through the cell membrane. Okay, and it goes inside, especially the these are marine products. These are not water-based products, though some of it is water-based. It will go to its necessary entrances, but it will readily feed the nucleus. The nucleus, we house the chromosomes. The chromosomes that we have is 23 from our mother and 23 from our father. Okay, together it's 46. If you have 47 chromosomes, then you have Down syndrome. Okay, and if you have 45, you will not survive because we are designed for 46 chromosomes. These chromosomes, if you entangle them, they will be in histones, chromatins. Now I've shortcut it. This is DNA deoxyribonucleic acid. And what's inside the peptide is actually inside this DNA. And DNA, you will see there that we have the nucleic acid. Okay, all the Subsubashi no Utsikoshi, they do have sardine or marine products also. All of this, we need the adenine, cytosine, thymine, and guanine. These are the nucleic acid. These are the repair system. Please be aware that, you know, all of this is in sequence. That's why we look different. However, to create one cell, you need nucleic acid, a 3.2 billion amount of this to create one cell. So the body now will actually, you know, create cells or produce cells, especially if the cell is damaged or dies, because we need a nucleotide here. That's why Subsubashi no Tsikoshi is perfect in terms of replenishing this. This is a cascade also. This is a snowball effect. You take only a few amount, and the body will process it in such a way, an enzymatic action, and this will actually create more nucleotide. Based on studies, the lack of nucleotide is actually the source of oncologic event in the body or cancers in the body. Okay, so now if you take the Subsubashi no Tsikoshi, okay, and these are replenished and used in the repair system, then the chromosome, okay, things are, we cannot change in the chromosome, the color of your hair, the color of your eyes, of course, the color of your skin, okay, your height, you cannot change that. But if this is from a you know, lifestyle, we are able to switch on or switch off those things that, you know, makes us sick. Like, you know, we can switch on something here that triggers diabetes, triggers arthritis, triggers cancer, triggers uric acid buildup. That's why these products is actually helping us, to change or to benefit in a molecular, not only a molecular level, but in a DNA and chromosome level. So when we take Subsubalashi no Tsikushi, it makes the chromosomes healthy, the nucleus healthy, making the cells healthy, the tissues healthy, and making the weak organ healthy. First of all, it will address the weak organs, okay? And that's a law. It's a law of healing, Herring's cure law. Okay, it's been observed hundreds of years, and it will make you a better you, Okay, so that is Subsubalashi. Now we go to Uchikushi. Uchikushi is one of my favorite. Why? Because if you heal the gut, everything else will follow. The skeletal, the kidney, the skin, the pancreas, the liver, the endocrine system, the brain, the lungs, the muscles, the microbiome inside our body, which is actually 95% is in the GI tract, and the sexual organ. Okay, Utsikushi. Okay, the thing here with it's Utsikushi, because 70% of our immune system is located in the gut. Okay, 70% of it. That's why when you take Utsikushi, okay, it is actually very beneficial because it has lactobacillus bifidobacterium and lactococcus lactis. Okay, so first of all, we talk about the super antioxidant inside the black garlic, the bromelain, the enzyme that actually breaks down almost everything. Okay, so grape skin, kiwi fruit for bowel movement. That's why when you take Otsikushi, sometimes you go to the toilet. Okay, especially if you have problems with your bowel movement. So these are super antioxidant. These are the prebiotics. What do you mean? Okay, these are the ones that are gonna consume. It will be consumed by the probiotics when you take this. Okay, and the probiotics is actually powerful. Why? Because it's actually, for example, if you want to help lower your blood cholesterol or manage your blood cholesterol, these are the prebiotics needed. Okay, these are also if you are lactose intolerant, this will be a powerful ingredient. Okay, ingredient when you take Otsikushi. Now you take your milk, you don't have that kind of problems when you take it, especially if you're lactose intolerant. Okay, it helps the all of this bifidobacterium longum, the lactococcus help the gut to produce this chemicals. We call it short chain fatty acid that helps the colon, okay, to be stronger, have energy, and it will not actually have energy and will actually help to to fight off, shun off the cancer cells. It is also all of this, even lactococcus lactis and bifidobacterium longum. This is also good for women. In our end here, we have Women's Health for the whole month up to the 31st of March. Now, we are discussing about the women's health, and one of the women's health here is we need probiotics. Why? Because sometimes women is prone to infections. Okay, these are the ingredients. Okay, when women take this, they will have a healthy reproductive organs, or we call it reproductive health. Even digestive orders. Okay, digestive functions is actually good. Growth of good bacteria, and Bifidobacterium longum is the one who's actually inviting all of this. I'm not inviting. I mean, he's the one managing it, especially if there's inflammation, infection. Okay, because the Bifidobacterium longum helps with the antiviral activity and anti-cancer in the colon. Okay. All right. So let's continue. Okay. The Lactococcus lactis is actually the ones recruiting all of the what do you call this? All of the immune cells in the body. Okay, and they are very rare, and that's why these are to complete the side. I mean the team, the immune cells. Okay, the Lactococcus lactis activates this plasmacytoid dendritic cell or PDC, okay, and acts on both the fast and slow immune system or the innate or adaptive, okay. So that helps you to, to modulate the immune system. Another thing here is all of this, okay, helps the gut to, bloat, okay, and to minimize the flatulence, if you are eating a lot of vegetables plus carbohydrates, okay, and there's a lot of flatulence there, and this will help us. Okay, so there you go, the marine superfood. These are DNA repair in a form of salmon DNA extract. It actually helps the skin to look younger. It actually, helps the brain. It's actually very good in wound healing. And because of its fucoidan or seaweed extract, this is actually a reverse aging or not anti-aging, but it's actually protective factor of one of the proteins that actually help. It's a sirtuin activator. It's actually that's 1 to 7, and it's the one responsible for elongating the telomeres by producing telomerase, okay, a enzyme that helps prolong the telomeres, and telomeres is the one responsible for the aging, for our aging, and it's also programming cells that is actually harmful for the body. These are senescent cells or cells that we call this in senior citizen, pardon for the senior citizens, okay, and not to be nasty about it, but the seaweed extract is the one that's actually killing them, and the body now will use that. The broken down cells will be used for recycling. Okay, so the patents for Otsukushi here is anti-tumor agent, immune activating, therapeutic agent for hepatitis C, infection protective agent, suppression, of the growth of tumor, and reduces of side effect of chemotoxic drugs, prevent and treat, cure infections of SARS. This is all based on their patents, but please, you may want to take the numbers here and do your due diligence. Protective action against toxicity or the side effect of the free radical reactive oxygen species, and help the reduce the toxic reducer. Why? Because it helps the liver to to detoxify them. So these are the things that the gut. If you're taking Otsikushi, if your gut you feel energetic, mental clarity, get sick less, or a good emotional well-being, and then you have started a healthy streak here. However, if you have this kind of autoimmunity, depression, anxiety, diabetes, dementia, Alzheimer's, I mentioned that already, then the gut probably has a problem here. Okay, so I just want you to know that we are, the bacteria is 10 to 50 times smaller than human cell, and there are actually, if we are 100 trillion, that's times 10 for them, okay, because they're so small. And if you're going to weigh them, that's equivalent to 4.2 pounds or 1 to 2 kilograms. And the GI tract surface, if you're going to lay it down, okay, side by side, the surface area is as big as 3 tennis courts or 400 square meter. Okay, and if you layer end to end, okay, in our body, okay, so the bacteria would actually circle the Earth 2.5 times. And I mentioned a while ago, the bulk of our own bacteria located in the gastrointestinal tract is 95%. So I'm just saying that we have all of this, the mouth, esophagus, mammary gland, liver, gallbladder, stomach, pancreas, the reproductive system of women, okay, colon, small intestine, and rectum, the 95%. And that's why we need the good bacteria from Otsikushi to make us healthy. Why? Because if they are overgrown, that's why have you heard about the small intestine bacterial overgrowth, and supposedly the good bacteria is residing in the colon or large intestine, but if it goes out to the small intestine, what happened? There will be havoc in the in the environment of the small intestine. These are the benefits of the microbiota: aid digestion, immune shape immune response, aid absorption of nutrients, create this bioactive compound. Are you aware that the prebiotics that we have and the probiotics, the Lactobacillus lactis, the Bifidobacterium longum, and the Lactobacillus, will create a B complex and vitamin K, aside from the bile acid and short-chain fatty acid. Okay, these are beneficial ingredients to complete. Why? Because vitamin B is critical in terms of the production of energy inside the body. Okay, these are acetate, butyrate, and propionate. Okay, so these are the benefits: glucose tolerance, insulin sensitivity, uses fat storage, and actually it's not a, the product is not a slimming product, okay? It's not a product that you will actually lose weight because the energy is being used, and then the metabolism is actually being addressed. That's why sometimes, some people lose weight and some people lose their appetite or appetite regulation. Okay. And bottom line here is we're gonna protect the colon. It also helps against leaky gut. That's why people who have leaky gut have arthritis, because it goes to the circulation, goes to the joints, and those food particles, okay, food particles and those virus and all those bacteria that came from the leaky gut goes to the joints, and the system attacks it. That's why people have, with leaky gut, you have joint pain as well. Okay, so these are, all right, because the other one is destroyed. These are the full presentation I have. Okay, and these are the gut and eye axis. All of this is connected to the gut. All of it, all of us. Okay, 90%. According to Hippocrates, the father of medicine, okay, he said that almost 80% or 90% of sickness comes from the bowels because some of us are unhealthy. That's why unhealthy bowels, I mean. Okay, that's why there are there are bioactive substance. They are actually boosting immunity, increasing energy absorption, cell production, and so forth and so on. Okay. One example here is the gut and heart axis. Okay, palpitation, breathing, high blood pressure, heart problems. Okay, another thing here sample is the skin. The skin. These are some of the problems with the skin, and these are one of our testimonies from AFC. This is there before, and you will see the after later. Okay. Another thing is the pancreas, inflammation, type 2, type 1, cancer. These are testimonies that we have gangrenous foot, severe, gangrene condition, open lesions. Okay, so another here, the gut and eye axis, uveitis. Okay, these are actually what you call this, the testimony from our Ikari, and this is her before and now the day after. Okay, so if there's a problem in the gut, that's why we need Utsikushi and Sopsubarashi. These are imbalances in the gut microbiota. Abdominal pain, allergic reaction, anxiety, bad breath, stomach grumbling and belching, flatulence and bloating, chest pains, constipation or diarrhea, not regular bowel movement, depression, dizziness, difficulty in peeing, girl issue, woman issue, infection, hair loss, difficulty in concentrating. Okay, you already ate but still hungry, weakness, heart problems, increased sweating, irregular bowel movement. You go to the toilet every 4 days or 5 days. Nail deformity, nausea, nervousness without any reason, rashes, skin disorder, thickening of the tongue, upset stomach, and vaginal itching. Okay, so all right. Yep. And we need to increase the fiber inside. Okay. All right. Bifidobacterium longum in Lactococcus lactis. I've already discussed this. This is just the summary. We just increased the good bioactive. We some of it contains multiple superfood. It's also good for vegetarian, even though it's a marine source. It's good for the heart, vasodilation, low glycemic index. Okay, and the smooth defecation here. All right. All right. So these are the ingredients. Okay, hikare. Hikare. We have the bifidobacterium, lactobacillus, the lactococcus lactis. These are actually consumed. And if you're gonna use this, I suggest that you wake up in the morning, you haven't brushed your teeth, and you can you can smell your breath, and it's not that good. It is the best time to take otsikushi and sopsubarashi. Why? The commensal bacteria inside your mouth and the ingredient inside the sopsubarashi, otsikushi, and hikari will actually combine together. And if you swallow it, okay, if it's absorbed, then the good bioactive ingredient is actually manufactured inside the small intestine. We have also the pearl barley, the black garlic, the bromelain, and all of these are vasodilators. These are found in hickory, the blueberry, the cherry extract, the black currant. These are natural nitric oxide precursor, okay? And the butyrate acetate, which is the short chain fatty acid. These are the protection, okay? The protection for the gut microbiome, protection for the lungs, protection for the liver, protection from the gut, okay, from any form of cancer forming cells. Okay, and there you go. We have the hickory. Hickory is, these are addressing the brain issue, the skin issue, and, these are psychiatric retardation. Okay, and all of this is actually even the grand mal or petit mal seizure from epilepsy. Okay. For the eyes, nearsightedness, farsightedness, and blurry vision, eye inflammation, age-related glaucoma, and eye cataract. So these are, okay. So I mentioned a while ago, we have 3 patented ingredient: Floral Glow, which is lutein; Numentics, which is a spearmint leaf peptide, and Dynamite, which is a mango leaf peptide. So this peptide is actually initiating, if we're going to combine it with the blueberry extract and all of this, even the inulin is actually a prebiotic here. If you're going to combine all of these 3, the Subsubashi Utsikushi, okay, and Hikari, this will be a very powerful ingredient. Okay, so let's go through the, there you go. All right, so we're just actually protecting, if it's hickory, okay, it's hickory, we're gonna protect the eyes, okay, and protective antioxidant benefit. Why? It's increasing the macular pigment so that the harmful blue light, which is found in your cell phone, is actually, being canceled out because of this pigmentation from Floral Glow or lutein. Disrupts ability to sleep, suppress the melatonin production because of that blue light, contributes eye strain, contributes age-related macular degeneration. It can cause eye cells or photoreceptor cells to malfunction and make you blind. And then brain health, there you go. Cognitive flexibility, complex action, reasoning, visual memory, okay, visual action time, reaction time. So it makes your brain sharper. Okay. Okay, so these are the 3. And another thing here is the Numentics. It's actually a standalone 10 clinical trials for people who wants to increase their mental activation and increase performance without increasing their blood pressure. That's hickory. So these are what I mentioned a while ago, and these are the patents. Improve visual health. Okay, number 2, protects the eye from blue light, improves brain performance and memory, improve brain function and activity, increases the level of production of new nerves and connections in the brain, neurogenesis. Okay, so hickory, brain, eye health, skin health, utsikushi, gut health, immune boosting, reverse aging, the same thing, reverse aging, stem cell production, bodily system health, and DNA repair. Okay, so these are the ingredients. Okay, so thank you so much. If you have questions right now, I think I extended. Thank you for your patience. But I'm now going to take a Q&A, if that's okay with you. Oh, by the way, I haven't shown you the some of the what do you call this? The testimonies that we have. Before we have this one, these are added testimonies. Let me just go here. All right, wait one moment. It's acting again. All right, so let me just go back there. All right. Before I show you, you have questions while we are showing the testimonies here, some of the testimonies.
I have a question.
Who's that? Mr. Oscar Stark.
Oscar Stark, yeah. I just
Yes,
want to
sir.
know if there was any benefit for heart, specifically atrial fibrillation, and what peptides would benefit for atrial fibrillation if there are.
Okay, first of all, the problem with that is first of all the heart, okay, and the circulation is somewhere in, something happened, okay, to the circulation. I don't know, probably the lifestyle. I don't know the lifestyle. Probably the person is highly stressed. Okay, I'm approaching this in a naturopathic way. The person is actually not only stressed, but eating high caloric sugary food. Okay, and the best thing here is to restore the structure and functions of the cell. Okay, and this will take time because we do have people even worse than that. Okay, we have actually people with testimonies have reversed their unfavorable health condition, but they started with Sopsubarashi and then Otsikushi, sir. Okay, so let me just.
Dr. Albert, just to add about the heart conditions there, because I have a heart condition pretty much in my life. Went through 2 quadruple bypass. I had a leaky valve on my right ventricle, and by taking the Sopsubarashi, pretty much about on the 7th month, I went in and they found out they could not find the leaky valve in my heart. That's pretty much states about how the Sopsubarashi works with the heart.
Wow. Wow, powerful. Wow. Wow. So, all right. So how many did you take per day, Rudy?
I was taking 2 Sopsubarashi and 1 Uchikushi at the beginning. And then when the Hikari came, I took the Hikari for 3 times a day for the first month. Then thereafter, pretty much 1 each and so forth. And that went on for about 20 months nonstop. So all the changes of what is talking about on a lot of these studies is really proven fact. We have a lot of testimonial already on a lot of the different issues and changes. When you say glaucoma and all those things, it does all relate to the word Hikari, but it works synergistically.
All right. Okay. So,
any other questions?
May I ask you
Mr.
a
Starker,
question?
did we answer your question? So what's happening? Okay. My internet stopped. Can you? Yep. Can you? Yep. Helen is actually raising her hand.
Yes. The question I had was, what was the name of the peptide for high blood pressure?
It's not a peptide. It's one of the action of Sopsubarashi no Tsikushi. Both of them, or I'm sorry, not Sopsubarashi, the fruit peptide and the sardine peptide. All of them has the ability to decrease the elevated blood pressure because of inhibiting the angiotensin, let me just, yeah, the ACE or angiotensin. Okay, wait one moment. Angiotensin 1 converting enzyme. Okay, it's actually the one that activates the blood vessel. If there's something wrong with the blood pressure, it will constrict. However, some of it is always constricting because you're stressed, you're eating sugary food, you're not sleeping. Okay, you're taking a bunch of alcohol or alcohol drinks. That's why this one, the sardine peptide, and the marine placenta is actually helping. Not only that, the fruit flow is helping with the anti-hypertensive effect. It's not a peptide. It's actually an enzyme inside the sardine peptide and fruit float. And another thing is the berries inside the cave, okay, and the black garlic and the all of the bromelain and all of that inside the otsukoshi. It has actually an effect, a vasodilator effect. It actually goes to the what do you call this? The pathway in which this kind of fruits and it's an anthocyanidins and all of the name of the flavonols or the antioxidant exert an effort in terms of producing the necessary precursor or a thing that will actually help the lining our lining of our blood vessels, either capillary or arterial, to produce a chemical, a gas actually, and that will actually dilate the blood vessel for it to relax so that the blood will flow naturally. I hope I answered your question, ma'am.
What about blood pressure? Just to let you know that within the first 2 months, I don't need to take any more blood pressure medication.
Wow, okay. Very brave. Okay.
This is Dr. Rich.
Okay, thank you.
Yeah, it's Dr. Rich.
Yes, Dr. Rich and Linda, as I'm showing you.
Yes.
Yes.
This is not a question. It's a thank you for Rudy putting these presentations together and for your explanation and your PowerPoint. Thank you so much. It's every week we listen, we get more incredible information. Your PowerPoint was awesome. I just want to reach out and say thank you. And Rudy,
thank you, Doctor. Thank you.
Yeah, thank you. God bless you.
And I
Thank you
agree
so
to all
much.
of that. Yeah.
All right, very good. Okay, thank you, Doctor. You haven't heard the things that we talk about with Dr. Sherry, okay, and that's more deeper for doctors. And I'm just being careful. That's why sometimes I stutter, and I try to be careful in terms of the words I'm using because some of the words are technical.
May I please ask a short question? Could you please just share your thinking about peptide injections?
Well, depends on the peptide injection. What is the function or the purpose of the peptide injection? Is it for losing weight? Is it for skin, making your skin more supple and glowing? Is it for, by the way, can you hear me? Can you hear me?
Yes,
Okay.
I can.
It's for, targeting a certain ailment or certain disease or any sickness that you're targeting. Depends. So if you're doing that, yes, ma'am.
Yeah,
Yes.
I was just wondering in general if you think that peptide injections they are going to act faster compared to peptides taking orally?
Of course, injection is much faster. However, we don't recommend our product to be injected. But if you have the peptides that you are prepared, I don't know what is the actual goal here for the peptide you're trying to inject to yourself. However, if it is actually beneficial for you, why not? You don't actually deprive yourself of good things. However, I'm just suggesting that the peptide that we are here have here is actually used in ancient times. We are just putting words peptide here, but it's actually a marine product that's actually filled with peptides. A peptide is, they're polypeptides, which means, more than 100 peptides that is connected to each other, and oligopeptide less than 100 or less than, that's connected. That will be broken down. Okay, when you take that will be broken down, or it will be used for the injections. It's actually being folded by the mechanism inside the cell, so that it will actually produce the enzyme it needs for its action. And it is, for me, it's much better. Anything that it's penetrating your blood vessel from the external external source, like injection, and that will be invasive. And I much prefer that orally. This is actually food. You don't have to worry about if there is future, because I don't know the studies about that peptide. Okay, I haven't seen if there is a side effect of that peptide, but the peptides that we have most definitely will never have the side effect of the injection type. So it's up to you. No one will actually prevent you for using peptide, but the best way is to put it naturally, orally, and this is proven since the 1700s, or it's more than how many 100 years, more than 100 years, 200 or 300 years ago, it's being used already. So it's up to you, ma'am.
Thank you.
May I ask you a question? Yes.
Yes, please.
Actually, it's a practical question. What is the necessity, you think, to buy? Because if I understood you correct, from like scientific point of view, everything is orchestrated by vagus nerve excitation and conductivity, as well as hormonal upregulation, right? So basically,
yes.
Right?
Yes, yes, ma'am.
Yes. So basically, I'm trying to kill two birds from one stone. So what would you say, okay, the minimum necessity which you recommend to buy, for example, for like indigestion and like problem with digestion and sleep, insomnia, and cardiovascular, like 3 conditions, you would say usikushi or something like more?
Okay, so if this is for tonic purposes, if you're gonna buy one package, that package probably 1 box of Sopsubarashi and 1 box of Utsikushi. That will be once a day, so that you can maximize that. If that's a 28 sachets, that will be 28 days. So you can maximize once a day. You will see the difference. Okay, you will see the energy. You will see the bowel movement. And of course, if you're going to take this and you feel sleepy, and then somehow there is a notification on your cell phone and said, okay, I need to do this, I need to talk, then the Sopsubarashi or Otsikushi, whatever you took for that night, okay, will now be a source of your energy, and you will not be able to sleep. That's why when it triggers the sleepiness, okay, please take that advantage, okay, so that you can sleep well. Unless otherwise, you disturb that cycle, the circadian cycle, then you will be energized for the whole whole night and morning. Okay. Anushka,
yes,
you're from what? you're from?
I'm from Florida. My name is Ann Bialik. I work in University of Miami doing research in neurodegenerative disease.
Your accent, is it Russian?
I'm from, sorry, I'm from Russia with love, from Moscow.
Okay. Привет, Anushka.
Привет.
Спасибо. Спасибо.
Can I ask more questions?
Спасибо.
Go ahead.
Yeah, да.
Okay, the question I want to know is, if I want to take all three products together to achieve maximum results, what dosage should it be for each?
Can you repeat the last sentence you made? You're far from the microphone. It's more on, there's an echo.
If I want to use all three products, what dosage should I take for each to get the maximum results?
If you want a tonic, okay, you may want to take one of each. Okay,
Yeah,
distribute
if I want to buy all three products, how should I take them together?
You distribute it for the whole day. You may want to take Subsubarashi in the morning. You may want to take Hikare in the noon, and then in the evening you may want the Otsukushi before meals or in an empty stomach.
Each one, it's one pill, not two pills?
Each one, if it is tonic, okay? But do you have any health concerns?
Yes, I have a lot, that's why, from each.
You have a lot, okay.
I want to combine everything to get the maximum results.
Okay,
well, I think, hey doc, every issue in the tissue is different. So the usage amount is more like more personal to each one, depending on affordability is probably another thing that some folks have concern with. But every issues and everybody, and my experience in the last 20 months is addressing this all the way through from every problem that I have, and then to take a look what product really works best for what, and getting your blood work every month or every 90 days. A lot of folks should be able to track it yourself, and then you could pretty much understand how does this making so effectively into our system. You can, there's a lot of proof and research that's already out there. Now we just have to reverse the issues that we have in our tissues. And I can tell you that because I used to have between $6,000 to $7,000 worth of drugs a month. Now it's zero. Okay. And yes, it changes your whole look. It changes your, I guess a lot of people see me today and they said, I can hear your voice, but I didn't see the body what it used to be, because it made a change in this last 22 months that I've been taking this product. So each one is addressed differently, and how and what issues you're dealing with, because when you look at what the science that the doctor's talking about, it takes you right to the issues in your tissues, and
nice.
So
Issues in your
where
tissue.
can I find out for which problem, or what should I do? Like who I can talk to, any website when I can read to, like, how to get the information more deeply?
You could call who brought you in and talk about it in detail, or you could call me directly and we could talk about it and just get my phone number. No problem. Everybody's welcome to call me any given time. My phone number is 530-209-8224. Okay, and I did not take this product to start with to get into the business, because I've been retired for 50 years in this industry, but coming back to help a lot of people based on research and based on what it changes people's life and improving everybody's life and reversing probably is another key. Okay, so all of those things make changes. So now what can we do to help slow down a lot of the issues that we see in everybody? Okay.
How much does it cost?
Every issue that, for example, on my kidney function jumped from 30% to 55% within the first 60 days. It took my diabetes gone after being diabetic for 27 years, 6.5 months. Okay. It removed, it balanced your pH level. It does. Reversing things, for example, I used to qualify to be a Santa Claus for 30 years. I'm no longer qualified to become a Santa Claus. 1/3 of my beard are turning black again. So and it glows your skin. And people see you and says, is this the same person? I see a lot of doctors, I see a lot of doctor friends who say, who is this guy? Okay. They're looking, and we just had our family reunion in September, and it shocked the whole family. And I came from a big family. There's 18 of us children. And when they saw me, they could not believe what they see. But I spoke to some of my relatives and friends, and I tell them, they say, what's the main ingredient? I say, salmon. Say, oh, don't worry, I'll just eat more salmon. It doesn't work that way. This patent process that they complete here, all for the research, like I said, it's already there. It's proven. It's up to us to go out and first experience it ourselves. You have to be the product of the product. You cannot take a product for 2 weeks or a month and say it works, it don't work, or I'm going to go sell. That's not how it works. Be a product of the product and have the proof, because all of these things we've been recording, and my last surgery was $1.4 million. They told me to go home. You only got 30 to 45 days of your life left. Well, guess what? I don't know if those doctors still alive, but I'm still here. So, then?
What's the price of this product?
The price.
The price. Okay. Well, if we're talking about now changing from about the product, about pricing, then I could briefly give you an idea of the two ways of the word pricing. Well, the Subsabarachi itself, we call the Subsabarachi Gold today. It's wholesales at $126 a box. It retails $175. Okay, and the Uchikushi and the Hikari, their wholesale pricing is at $116 approximately. I say that because a few pennies here and there difference. And then it's $150 per box for retailing. So that's why there's two things we're looking at here. Number one is this company is designed to help a lot of people become mobile stockers. And a mobile stockers doesn't necessarily mean you're going out there and selling all these products yourself, but at least you're out there helping and getting the product for yourself at wholesale. And we have the availability of this system today that's very unique for us here in the United States and Canada. Okay, and I could go that more in detail, but not right now here. Okay, because it's a more elaborate of my experience with the company for the last 22 months. So yes, I can go one-on-one and explain that and help folks to get their product based on the mobile stockers program. And the mobile stockers program is where this all started in Indonesia. And then later on is when because mobile stockers is like buy and sell. It's like e-commerce. You buy wholesale, you sell it retail. You buy wholesale, you consume the product and not having the major expenses. So yeah, that is the first step. Second step, when the company opened, actually in late 2017, they developed the pay plan system, and whoever brought you in here could explain that more in detail. If there's any questions, we will be doing more training on that area. But today, we're already way extended in time, and I thank you guys for your patience to be here.
Rudy, I have one more question.
Yes,
with
go ahead.
Dr. Albert. Dr.
I'm
Albert.
still here. Yeah, I'm still here.
Yes,
Yes, Doc.
yes, thank you. We have a lot of people on the line, a lot of doctors, naturopaths, people that are doing the business, people that are just looking at the product and I just need a general idea. So the question is, we understand what product, a lot of us understand what product people need. And if they have something, if they're just taking it for maintenance, to be healthy, it's one a day. But if they have something wrong with them and they're on a budget, what we're having them do is take a double dosage, the first month with the products, and then go single after that. But if they have the money, right, to take whatever, and they have some serious issues, what is the protocols in taking the product? Do they take it double dosage or whatever for 6 months or until they get rid of that illness, or is there a certain way of doing it, and how long?
Okay, so thank you for asking, Doc. Regarding that, first of all, if the person has what you call constraint in the budget, okay, so what would be the best product to take? It depends on the person. If it is, if it is, this is what I'm doing. If it is in the gut area, most definitely, if we can only afford one box, so that will be squishy. Okay, it will be if it's in the what do you call this
organs,
cancer type, that will be Subsubashi. Okay, that's what we need. And okay, if the person is very very tight in the budget, however, for it to for cancer, for it to be successful, you need to put otsikoshi. So if there's an additional funds that you can get, that will be one of each, at least there is. Okay, for people who have tight in the budget, they should refrain from doing these things that actually will actually render the subsubalazine otsikoshi useless. Would you like to know?
Yes, for sure.
Excess sugar, carbohydrates, number one. So example, white bread, donuts, pastries, ice cream, cookies, okay, pasta. These are actually, if this is making you increase your sugar, okay, or you have cancer cells, we don't want to feed the cancer cell with all of this goody treats. Okay, second, if they're taking alcohol, that's why they're in that mess first place. They're probably taking alcohol, okay, and probably alcohol is actually a multiplier effect for people, especially when they're taking sugar, for fatty liver, okay, fibrosis of the liver, cirrhosis of the liver. Okay, number two, alcohol is actually will exacerbate the formation of gallbladder stones. Okay, it will actually trigger uric acid production. Okay, so, and we don't want alcohol, because there are two types of liver. Fatty liver is non-alcohol and alcohol fatty liver. So the liver is it has 500. You're aware, doctor, that it has a 500 functions. If there is a fatty liver that already depleted the 500. So the liver is responsible for the hormones. Okay, Rudy, Dr. Cherry will actually asking for what is in the hormonal imbalance. The hormonal imbalance is, succinctly put this, you have too much sugar, you have too much alcohol, you are not sleeping you're disrupting your circadian rhythm, and then you are highly stressed. So these are the four basic disruption of your health. So if you're gonna shun from this, you're gonna eat a little bit healthy. You refrain from alcohol. You take a lot of mineral water or alkaline water, and then you take what do you call this? Fibers, not too much fiber because it can cause flatulence as well. Balanced meal. What I'm saying, instead of high sugar, if there's craving, probably there is a sort of parasite that is actually triggering you to eat sugary food. Okay, and then you may want to help yourself to sleep, because if you're aware, there is a science here that's recently mentioned. We call it the lymphatic system. If you're going to sleep, the brain will shrink. Okay. And all of the sugar, the toxins inside, will actually, as if moving the brain for momentarily, and then it goes back to normal when you're awake. So all of these toxins will go to the lymphatic system, okay, and going out of the body. However, if you're not sleeping, it will stay there. It will create plaque, amyloid plaque. It will create calcification of the brain. That's why there's dementia, there is forgetfulness, and there is future Alzheimer's. So it depends on the person. If you're gonna shun this, so they can take Subsubalashi, that's okay. If they want to, hasten the healing process, they're on the budget. Subsubalashi will be the one. If they have gut problems, okay, if they have diverticulitis, they have ulcers, that will be Utsikoshi. Okay, if they have eye problem, okay, if they have dementia, if they have problems with what do you call this, any psychiatric and psychological problems, they may want to take hickory. Okay, eye problem, psychological problem, and then skin problem, hickory. Okay, that will be if they're on the budget. However, the combination here for a what do you call this, a very powerful combination to trigger the healing process of the body, that will be hickory at Utsikoshi. If there's for the eyes and for the skin, there is severe acne, there is eczema, and so forth and so on. Psoriasis, okay, that will be okay. Still in the budget, but you need to choose two. Okay, if it is for tonic, Subsubalashi is okay. If it is for bowel movement, you don't have anything. You have problems with bowel movement. Okay, it's Utsikoshi. Anything with the gut, it's Utsikoshi. Anything with the healing process, it's Subsubalashi. Anything with the eye, skin, okay, and eye, skin, brain, that will be hikari. Right.
Well, just to add on, Doc, if the issue is not the budget, if the budget's not an issue, and there are issues in every tissues, then what I see, the worst that possibility if someone taking Uchikushi on the deepest states is 4 times a day. On the Subsubarachi, average about 3 times a day. Now the Subsubarachi goal, see, I don't take those, I only take one Subsubarachi goal now, and I only take the Uchikushi every other week now. And when you're first starting with the Hikari, you should always start with 3. And yes, I have folks that actually were scheduled for cataract surgery, was canceled after less than 60 days taking it, but actually he was taking about 4 times a day because he was kind of worried. But I don't hear, and I've heard folks that taken 8 Uchikushi and 8 Subarachi a day, no issue. But the worst possibility I've heard from 2 individuals is feel bloating, but that's way too high, taking too much and so forth. Okay.
Yes,
Number 1,
yes.
2, I do have somebody with thyroid issues, And he thought that I told him to take the Hikari three packets 3 times a day, and less than 45 days, he said he was feeling bloated. Those are the only 2 words that I hear about the word bloating because they overtook the product. But what happened with that individual, the issue went away after 60 days. So maybe if the worst possibility is to feel bloated, I like to hear it.
How many is too much? Yeah,
Yeah.
Rudy, how much is too much?
Yes, you take it too much.
How much is too much?
Well, it depends on what the issues of the tissues.
No. The person you're pertaining to, how much did she took? That's why
The one that was taking
bloated.
too much was taking 8 subseparatian, 8 Uchikuchi. And I said, well, I said, there is such things what they call diminishing return. You don't need to take that. But the reason why she was taking it was that, she wants to see how fast can she be young again. Well,
No, she should take subsubstantial once she wants to be young. And hikari, not because of the good bacteria. You will increase the ratio of good bacteria is now more, and that's why you're gonna be bloated. You may want to add what do you call this, a prebiotic. If you have increased, accidentally, you don't know, you may want to advise to add additional fiber or prebiotics or fiber in if you accidentally increase the Yochikushi.
All right. Hey, thank you everybody for having the patience. Thank you everybody for being here at the extended time.
Rudy.
Hold on a second. Those who don't have any questions and want to go ahead and leave the room, that's fine and so forth. But we'll take the next 2 last questions, please. Thank you.
Rudy, Dr. Rich, this is not a question. It's in dealing with patients and supplements. They always want to know, can I get a sample? And I like to use analogies. So I tell them, would you take 1,000-mile trip in your car and try to get there on a gallon of gasoline?
Can I get a sample of gas first?
Wow, that's a nice analogy.
Yeah, and they say, no. I said, then you have to get enough gas to get to your destination. It's no different with products.
No
You have to
different with
take
products. You have to
Are you paying for my gas?
Yeah. Anyway, that's what I use for my patients, and it helps them understand it's going to take more than a sample to alleviate their problem that it could have been there for 3 or 4 or 5 years. So thank you.
Okay.
Well,
That's great.
could you please repeat your phone number? Mr. Rai could you please repeat your phone number?
Rudy.
Is that for me?
Yeah.
It's 530-209-8224.
Thank you.
You're welcome.
You forgot the D in your name, Rudy. It says on the screen.
Oh, I'm sorry. That was a mistake. It never been fixed. Thank you again, everybody. I appreciate your time, and thank you. It's been a long morning and late night for the doc and Albert and Fredo. So, thank you and good night, good morning, good afternoon. Pretty soon here, and enjoy. If you have any questions, call. Okay.
Thank you so much.
You're welcome.
Thank you.
Everybody, thank you, and have a beautiful day. Enjoy.
Thank you.
All right. We'll see you later. Bye-bye.
До свидания. Спасибо.
Number, please.
One more time, Rudy. Number.
Bye. See you later.
One more. Your number, Rudy. One more time.
530-209-8224.
Yep. Great.
All right. You have a wonderful day. See you all later. Bye-bye. I'm running late to another podcast.
Am I going to end it all now, Rudy? Because the all right. Thank you.
You're welcome. Bye. Yeah.
Аня, не говори своих восторгов. Я не хочу через неделю. Примерно. Вот, я просто хорошо, что мы успели. Она, конечно, активная. Сейчас я ему позвоню. Давай я ему позвоню. И скажу, можно я позвоню? Папа, я работаю. Где он телефон? А где мой? Вот телефон, куда это? Господи, ты не брала мой телефон? Нет. Ну как же так, а? А вот. Я ему позвоню. Пока мне Аня не позвонила. Так.
Добрый день, вы меня ждете, ребята? Алло, hello?
А как отключить?
Танька? Я вообще не вижу, кто здесь, но я
Да, я тут, но я выхожу уже.
Хорошо. Сейчас, ага.